Hello, everyone. I'm Dr. Renee. Today's podcast is on neck pain management. Most of us experience neck pain or neck discomfort. It could be a stiff neck due to poor posture, hunching forward, too much dependence on our cell phones and our laptops and our computers, physical strain. All this contributes significantly to neck pain, neck discomfort. But when it gets really persistent and chronic, that's the time one should then be seeing a doctor. So joining me is Dr. Kavita Gupta. She specializes in physical medicine and rehabilitation and is affiliated with many hospitals in southern New Jersey and Philadelphia. And pretty much everybody I know the other will have neck pain. So how do we go about addressing it?
Yeah, absolutely, Renee. And thank you for having me here. Neck pain, as you know, is a very, very prominent issue. It leads to a lot of cascading other problems. First and foremost is headaches and tension. And it just leads to mood disorder because everything kind of weights on the shoulders and in the head. The head is, as we know, is about like 15 pounds of weight. It's the burden on your shoulders, and we're carrying it around all day long. All the stress, everything kind of comes through our neck. Let alone if you have other issues going on underlying in the neck, whether it be arthritis, muscle tension, or any other congenital or things that you may have been born with, that you have no control over, you have those other issues that you have to deal with. So it can lead to those other problems. And the number one thing that people can deal with are headaches and muscle tension and muscle spasm. Patients oftentimes will come to me and they'll say, I have pain that's right in my shoulder, right here, right in between, but from the base of my shoulder to the top of my neck, and I'm feeling along. And this big muscle right here is your trapezius muscle. It's a very big muscle, and they'll feel a knot, and they'll go for massage therapy, acupuncture, acupressure, which oftentimes can relieve the pressure and the pain, but it oftentimes comes back. Why does it come back? And it's because the muscle has a memory. And when the muscle has a memory, it just goes back to its bad habit. Muscles have a habit, and we need to learn how to change the habit. And neck is something that we do things on a day-to-day basis that can make those bad habits just come into place. What do we do? You mentioned a couple of those things. Being on our cell phones, we're always bending forward. That's the technology of today. And we're crouched forward. And I go over all of this with patients. I make sure that we're working from home. Is your desk set up proper? Are you eye level with your computer? Are you slouching forward? Is your arms at good length? Because even if your shoulders are slouched down forward, it puts tension on your neck. So you have to make sure that everything is properly aligned. You know, you're giving arm rests to where you can. I mean, these things make a big, important, make an impact.
Because that can create a lot of not just discomfort, because you can get headaches with it, as
Yeah.
you mentioned. So it's like a domino effect, bad posture, headache, stiff neck, and then mood disorder with this whole situation. So it's just better
Absolutely.
to have proper posture. So when you're on the cell phone, don't lean forward.
Mindfulness, it's being aware of your situation, of what you're doing, that, oh, my posture, you have rounded shoulders, sit back with your shoulders, retract your shoulders, pull them back. If you like to watch, if you're a TV watcher at night and you prop up with a bunch of pillows and you fall asleep like that, you're going to wake up with a stiff neck. So it's very important to know how you sleep. Sleeping posture is something I go over with patients, especially with neck pain and headaches, because and the pillows that they use. If they use a mushy, soft pillow, it's not good for you. If you're using too many pillows and elevating your neck too much, that's not good for you. You need to be neutral with your neck. You need to support the small of your neck. That is where the support is needed. Think about when you fly in an airplane, those neck collars. What are you doing to your neck? You're supporting the small of your neck because that's what needs the support. Same thing when you sleep. people go neck pillow shopping, and there are many, many different types of neck
Yeah,
pillows.
orthopedic pillows, they like curve around their neck.
Yes, they actually have like a gully, and that is meant for the small of your neck. So, but not every, it's not a one shoe fits all. You literally have to try the different types of neck pillows, especially if you're suffering with neck pain. So, I would suggest for someone with neck pain and tension in the shoulders that you look for a very good neck pillow and you use a very good, firm mattress, and you have a good position with sleeping, because that is partially a lot of the problem. Because you wake up in the morning with a stiff neck, your day starts from there, and then everything goes downhill. The tension, the muscle, the workload, all of that, the posturing, and then the headaches begin. So it just is a spiral downward from that day, from that forward. So, and the muscle knots and the tension. When you come see me, it's like unraveling a very like a big knot that's been in place for so long, and it takes a lot of time and a lot of effort. A lot of effort comes from the patient, so you have to do a lot of work aside from what I can offer. I can do things such as offer you suggestions and do injections and give you medication. But medications are there, but oftentimes they're muscle relaxants, and they all have a lot of side effects. Sedation is one of them. People don't like that. They don't like to feel groggy and tired and feeling that they can't function. So that's the downside of being on a muscle relaxant. They say, give me something to help me. And that is the thing that you can give them, but there's a price you pay. You get a side effect.
The pain is severe and it gets to be chronic and it's persistent. Do you recommend MRI and CT scans?
Absolutely. I mean, if it's not unraveling and you're getting other symptoms like numbness and weakness, and you're having other symptoms like you're dropping things, or maybe blurry vision where it could be affiliated with your neck, or trouble with hearing, or imbalance or coordination issues, balance issues. Yes, you definitely need a CT or an MRI. You would definitely get those studies. You don't necessarily need to get it if you just feel like you just slept funny and you feel sore. These things can be usually, trained. Muscles need training, and you have to train the muscle. And that is partly why, you have to do these things on a regular basis, to kind of prevent. Prevention is the cure. If you
Absolutely. I
eh,
know.
that's the key thing. That's what the take home message is: prevention. To prevent you coming for doing these type of taking all these medicines, doing injections. Like someone may suggest a trigger point injection. And why do we call it a trigger point injection? And I'll explain that is because I press on a knot and I press on a place in the shoulder that will create a response in the patient. It triggers a response of pain. So that's why we call it a trigger point. So then when we inject that area, we put a little medicine to create that area of trigger to calm down and calm that inflammation and create like a calming sensation, break that pain cycle. So it's not a bad idea to do it once in a while, but not very often. I like to caution patients not to get it done too often, but it's a very good option to use to keep this from becoming like a chronic problem.
Now, what can we do at home? I know we talked about good posture, could be stretching exercises, pillow, that's like more orthopedic pillows, gentle yoga. Besides
Yes.
that, acupressure, we can do at home, physical therapy, cold compresses.
Yes. Cold and heat. Okay, so the big question people ask me is when to use cold and when to use heat. So cold compression is like, let's say you wake up in the morning and you have, oh, my neck is stiff. I would use a cold compression. If you have a situation that reoccurs and it happens very frequently, I would invest in buying an ice collar or a cold compression, something that you can keep in your freezer, wake up in the morning and carry about your morning, and slow the muscle. The muscle goes into slow motion. The muscle now doesn't fire as aggressively, and it now cannot contract as fast as it can, and it slows down. So then that muscle spasm is less, and you can kind of feel the effect of the cold. You use heat to allow blood flow to when you're feeling a muscle ache, fatigue, and you're feeling sore. You use a heat pack to calm and give you that relief so blood flows in that area to allow that muscle to kind of relax. So, like at the end of a day, you can use a heat pack, and that would be soothing for an area. So that's kind of the rationale between hot and cold. Um, and there's many companies. I personally like to use cold compression on someone who has a chronic issue or someone who hurt, like someone who had whiplash, someone who's been in a car accident and they suddenly get into an accident where they get hit from the back. And a whiplash injury is suddenly when you get hit from the back and your neck goes like this. You have very strong ligaments in your neck holding all the bones together. But if you're in a sudden force of a car accident, then those ligaments can get overstretched and they could even tear. And that's what whiplash is. So then we use a cold compression to calm that inflammation, slow down the muscles. And there's many units out there, TheraPoint and many others out there that are very effective for these type of situations.
So can that be used at home? The cold
Yes.
compression kit? Okay.
Very much so. And that's like if you've been hurt at work or something hits you, or you've been injured in a car, you've been in a car accident, or you fell, ice and cold is the number one thing to do.
What about some acupressure points that will relieve the pain in the neck?
Yes, acupressure is very effective as well because you're allowing that muscle, you're kind of trying to break that pain signal. You're trying to break that, you're trying to,
You want to break that circuit. Yeah.
yeah, you're trying to break that circuit of pain and you're trying to create like a new muscle memory circuit. And your body is a network. It is a muscular electrical network, and you are trying to just reestablish a good communication between all the networks in your body, between the nerves and the muscles. And that's how I like to explain that to patients. Well, because you are dealing primarily with pressure points that are all in the trapezius and in the shoulder blade and in between the shoulder blade and that's the very most common area where acupressure points are. So you need somebody to do them for you. You need, and you can kind of go along the muscle of the shoulder of the trapezius, and someone could find them. And you need about 10 pounds of pressure. Really, the person should not be afraid to really put that amount of pressure into that muscle. And that's usually when someone who doesn't know how to do that kind of acupressure, they're often not giving enough pressure. So someone who's experienced in acupressure should be able to kind of give you the amount of pressure you need to get the relief you need.
So for muscular and nerve spasms, one can do all these self-care measures at home. But if it's like a pinched nerve or a herniated disc, they definitely have to see a doctor.
Yes, herniated disc in the neck would give you symptoms of numbness, tingling, possibly going down the whole length of the arm, possibly into the fingers, and even weakness. It could give you, it's radiating completely into the arm, and you'll be feeling like your hand is falling asleep, you're burning or a numbing type of sensation. And that is something that if it doesn't go away, then you would want to or it goes away intermittently, you still want to have that evaluated further because that's not just a muscle spasm. Muscle spasm and muscle is very focal. It's isolated to one area and it's a very throbbing, aching, pulsating type of pain. Whereas that burning, shooting, electrical numbness is nerve associated. And that's possibly because a nerve is getting pinched somewhere along the neck.
Prevention. Can't stress enough. Early intervention and prevention. So it's
And good genes. And good genetics. You can attribute sometimes early arthritis to parental genes. I mean, sometimes those things you can have early onset arthritis that could be there. Not only that, I mean, prevention, wearing seat belts. I mean, there's so many people who don't wear seat belts in their car. And if you're not wearing a seatbelt and you get into even a minor accident and your head goes in a slight hyperextension, a slight whiplash, you could herniate your disc. So careless walking, like if you're walking and trip and you fall off a curb and you could even, throw your neck back. You don't realize how your neck could get easily injured with simple things. So being very careful with your routine, proper sleeping, seatbelt wearing, walking, like, if you're doing high impact sports, uh, you got to be careful, how you do
Of
things.
all these activities that we
Yeah.
do on a day-to-day basis, and we many times don't even think about it, but that's important that we are careful how we go about it.
Yes. High impact and these seatbelt and all of these things are more issues if you're going to look at like a high, like, an injury, like a herniation, where you're looking at trauma to the discs and nerves. Where we're looking at chronic and muscular and muscle tissue injury is when we're looking at remote workers doing repetitive injury where you're, leaning forward, kids on their computers, always hunched over, proper, not sleeping with proper, etiquette with pillows, those type of things. That's when you start getting that neck pain, when you start doing it and not properly stretching, doing that kind of thing. That is when you start developing the muscle tension and added stress, add stress to the, throw that into the, as an ingredient that just compounds and makes everything much more worse.
Yeah, and to get more deep relaxation with all the pain, I think one big adjunct therapy would be meditation. So
100%.
calm
Yes.
yourself down and get into that quiet zone.
Right, because it's been shown, research has shown if you do that relaxation breathing, you're bringing your blood pressure down, you're bringing your pulse rate down. And when you're bringing that down, that also affects the reflex arc of the muscle, which causes that muscle to slow down how the muscle reactivity is. So in turn, you're going to allow that muscle to slowly relax. It's not going to be immediate, but when you're doing it regularly, you're going to see the impact of that.
Well, thank you so very much, Dr. Kavita Gupta, giving out your insight into how we can manage neck pain. That's so very important because very much, I think 1 out of 3 adults have it.
Yeah, I have it too.
We all have it, right? I was
We all
thinking,
have it. There's no discrimination with neck pain.
yeah, right.
Definitely.
Equal opportunity destroyer.
Yeah, absolutely.
Well, thank you
Thank
once
you, Renee.
again. Thank you.
Okay.
And
Have a
I'm
good one.
Renee Mera. Stay healthy, stay positive.